morning, Nancy. Ladies and gentlemen. It's really my great honor that for you guys attending this wonderful session. And I am Steve, and I'm a PhD candidate in the Department of Physical Education and Sports Sciences. Today, I would like to discuss about the topic, the influence of acute resistant exercise volume on the inhibitory control, a randomized control trial. Okay, let's try to do the role of inhibitory control again. And the cognitive function is a kind of mental process the brain uses to perceive, process, and respond to information for both internal and external sources. Among the cognitive function, the executive function is the most important one, and it includes three main domains. The first one is working memory, and the second one is cognitive flexibility, and the last one is the inhibitory control. Among all those executive functions, the inhibitory control might be the most important one because it facilitates the suppression of irrelevant stimuli to maintain focus. So it can improve our quality of life or academic performance. And according to the previous studies, the definition of resistant exercise is a kind of a modality that uses your muscles to counteract the external resistance in various modalities. For example, like the bodyweight training or suspension training is a kind of resistant exercise. And for the physical activity guideline for the Americans or the WHO guideline for the sedentary behavior, it all recommends that all populations should do at least 2 times of muscle strengthening activities during a week. So they stratify the importance of resistant exercise and the cognitive function. And the pre-established research of this field, Dr. Zhang has established the most wonderful research about the inhibitory control and the acute resistant exercise. However, the imperative of the equalized volume to determine the effects is still needed. What I mean by that is because the relationship of resistant exercise intensity and executive function performance is still unclarified. According to Group et al. In 2021, we can observe from this figure that x-axis is exercise intensity and y-axis is the exercise function performance. We can realize that in the moderate intensity, the performance of executive function is the most higher. However, this kind of studies did not consider about the total volume of resistant exercise. What I mean by that is because the resistant exercise component is very complicated. It consists of the set, repetitions, and intensity. All those 3 different components together will be the volume. Seems that we can realize that the scarcity of control studies on moderate intensity resistant exercise and volume at the same time. Since the randomized control trial aligning with the American College of Sport Medicine guideline is needed. So this kind of things lead us to consider about the standardized total exercise volume across different intensity. So this study recruited participants, and we calculated the sample size by those different kind of software. And the experimental design allocation is that it's a kind of single center, open level, and power on randomized control trial. And we utilized the stratified randomization, which means it's all equals 1 to 1. And the group allocation is that we divide those participants into 3 groups. The first one is the low intensity group, the second one is a moderate intensity group, and the last one is the control group. And all those three different kind of groups, and we try to match the total volume and the exercise time or intervention time. And this is an experimental procedure. We can observe from this figure, before any intervention, we do the baseline assessment, and after that, we randomize participants into three groups. And they will all do the pre-task and post-task to caliber work task. And during the exercise intervention is administered by the National Strength and Conditioning Association certified personal trainer. And the main modality for resistant exercise is a kind of multi joint compound exercise performed on the Smith machine, which consists of 4 movements. The first one is bench press, and second one is band row. The third one is squat, and the last one is deadlift. And the work to rest ratio and tempo is 2-minute interset rest intervals. And we also standardize the tempo during the exercise, which is the 1 second for concentric and the 2 seconds for the eccentric phase. And we did monitor participants' physiological parameters. The first one is the heart rate, and the second one is the bilateral elbow, and the third one is the subjective perceived, which is also known as the RPE. And we utilize this dual caliber task to assess participants' cognitive function, especially the inhibitory control paradigm. And we can utilize all those kind of scores or any kind of interference scores to assess that. And during the statistical analysis, we do some kind of data preprocessing to correct the baseline. And we use different kind of statistical model to try to realize what's the main effect of all those interventions. And we can see the result for the demographics. Each group has 26 participants. And from this figure, we can see that the x-axis is different kind of groups, and the y-axis is the inverse score of the two-color work task. And we can see from this figure, the exercise groups are all better than the control group. And about the data level, we can see from this figure, and during and among all those different time points, pre-task, mid-task, and post-task, and the y-axis is later levels, we can see that the control group, there is no significant difference during all the time points. However, we can realize that there is significant difference between the exercise group and the control group. Since that, we might try to give you guys some main findings of these studies. That is, the acute resistant exercise significantly enhance inhibitory control compared to the non-exercise control group. And the moderate and low intensity protocols yield equivalent cognitive benefits when the total volume was held constant. And both groups exhibit comparable increase in blood data levels. It suggests that a similar acute metabolic response supports these cognitive gains. And while this happened, we want to discuss about the impact of exercise intensity and volume on inhibitory control. We can realize that previous study or research suggests a broad effective range of effective dose. which is during the 40 to 90% of 1 AM for improving inhibitory control, and with the potential threshold for maximal benefits between 53% to 80% 1 AM. However, there is still some kind of dose response debate among all those studies. And earlier studies have proposed an inverse U-shaped relationship for a different kind of exercise intensity and cognitive performance. So after that, we can try to induce some kind of conclusion that is the volume might be the key factor for determining the acute effects of resistance on cognitive function. And this kind of finding is really applicable and to those clinical applications because the use of lower loads to enhance executive function and broaden the accessibility for a population unable to perform those high-intensity resistance training. And from the physiological mechanisms and exercise modality, we can also induce some kind of conclusion from these studies. That is the metabolic mediators, the latent migrate and primary energy source and signaling molecular for the brain during the exercise, especially the resistant exercise. And this study outcome have shown that both moderate and low intensity groups exhibit similar increase in blood-latent level. And we can try to extend that finding to a different kind of application, like the different kind of movement capacity for the exercise modality selection. That will be the future study. Since that, we might provide you guys some kind of conclusion and take-home message. That is, the moderate intensity resistant exercise benefits might elicit immediate benefits for inhibitory control, and the volume match low intensity resistant exercise might also yield comparable cognitive improvements when the total volume is equalized, and the physiological response might be similar increase and during for this kind of resistant exercise. That's it, and thank you guys.
So, any questions?
Thanks. That was really interesting. Thanks. I mean, it's because it's what I study, but I'm wondering about if motivation or cognition plays into it in the sense of, you know, are people using their brains in different ways to inhibit what they're doing to be more active or something like that? I'd love your thoughts on that.
All right, thank you. Thank you for your insightful suggestion or comment. I think it's quite important to consider about this because participants' motivation will surely influence the result of this kind of study. Thank you.